Next lesson in our emergency medical response course talks about recording vitals. And let's make sure we know where this all fits in. If you are able to respond promptly and safely, find where you're going, not cause any wrecks, get there quickly, get into the scene, get yourselves organized, do this all safely, be nice to Mrs. Smith, be safe with Mrs. Smith and with you and the rest of your crew, and be really good at finding out what you can do to help her from a medical perspective until the paramedics get there. And you would use your assessment and treatment 5-step plan. Are we coding this guy? If he talks to us, we're not coding him right now. So we're going to check with circulation, ventilation, oxygenation. If he's breathing less than 8 or more than 28, we're going to ventilate. We're going to look to provide some oxygen to get his pulse oximetry in the 94 to 99 range, unless he has lung disease. We'll talk more about that later. We're going to work on peripheral pulses. We're going to do a rapid exam where we find and fix things that are wrong. Now, if the man called us because he's having a stroke, or he called us because he's short of breath, I'm not sure we need to spend a bunch of time pushing on his belly, pelvis, and femurs and checking him for wounds. That isn't what he called us for. But if he called us because he wrecked his car into another car and he's stuck behind the wheel and we're doing extrication, and extrication is really fun, but there needs to be medical care going on while we're dismembering the car. So we need to put one of us next to that patient, and we don't need a paramedic next to that patient. We need one of us next to that patient, and that person needs to be able to find and fix some injuries. And then let's get some vital signs on all these patients. Let's be able to get some vital signs. We're going to need to write those down, and we're going to need to deal with some history stuff. So we're going to record vital signs, not just get them, record vital signs and record history using the very valuable, pretty cool EMS Notes, the blue form, and we're going to use that as soon as practical. Now, some folks like to write on their glove, like to put a piece of tape on their leg and write on that. That's cool, that's fine. But that EMS Notes form really helps the paramedic crew, and they love us for having that form. So just a quick diversion. The EMS Notes form came to be from an EMT class that we taught in 1995. It's been around a long time. The EMT students said, we need a place to write stuff down, and could we possibly have maybe that as a prompt? Because at 4 o'clock in the morning, we have a hard time remembering our name, much less all the things we should try to get in history and remembering vitals. And so the EMS Notes form is used in the field on real calls, but it was developed as a memory aid for EMRs and EMTs a long time ago. The EMS Notes form gives you a place to write the time. It gives you a place to write lots of stuff, but if you don't write how anybody can read, I'm not sure you've recorded anything. You've just scratched on paper. So, and then the last line there is a very important comment. 1 blood pressure, 1 heart rate, 1 breathing rate, 1 pulse oximetry reading. They have some value, but several readings taken over time have a lot of value. So if we can see a trend that the pressure is going down and the heart rate's going up, or the pulse ox is getting better, or the pulse ox is getting worse, if we can see a trend, that makes a huge difference. And boy, if you can add that to your handoff to give to the paramedic crew, they love it, because now they can already see a trend, or there's at least one data point, one set of vitals from you, and then they can take some, and now they're starting to see some trending. Trending matters. Record these vital signs. What are the vital signs? Well, there's a blood pressure, there's a heart rate, there's a breathing rate, a lot of people call it respiratory rate, respirations, and there's also a pulse oximetry reading. At the EMT level, we'll show you about another one called capnography. At the paramedic level, we love capnography. It makes a lot of sense, gives us a lot of good information. Body temperature reading, a temperature. If we had a thermometer available and you could take the person's temperature, temperature matters. So vital signs can include all those things. Some people think that the vital signs also include the patient's pain levels or their pupils. So you can add or a Glasgow Coma Scale. There's an EMT level thing. We can add all kinds of stuff into this baseline vitals category, but really at the EMR level, what we're trying to get done: blood pressure, heart rate, breathing rate, pulse oximetry. That's the 4 we're looking for. So how do you take a blood pressure? Well, we will practice this over and over. We'll take blood pressures every session for a while, and somebody will check my pressure every session because that's just a good thing. So how will we do that? We'll put a blood pressure cuff on an arm. Usually we could use a leg, but that's weird. And we can use arms. Arms are better if you have arms. So we'll do something with a blood pressure cuff on the arm, and we'll use a stethoscope, and we will try to hear sounds that are made as we release the blood pressure cuff. We pump it up real high, like 200. We listen for sounds. If we hear sounds, we pump up some more. If we don't hear sounds, we start lowering the pressure, letting the air out of the cuff, and we listen carefully. And when sounds occur, that is the systolic number, the top number. That tells us the pressure during the contraction of the heart. And then we continue to let it off a little bit, slowly. The slower the guy's heart rate is, the slower we got to let the cuff off. You let it off slowly, slowly, and then at some point the sounds will get either a lot quieter or go away completely. And that's the bottom number. That's the diastolic number. That's the pressure while the heart is refilling. So systolic's during contraction, pumping of the heart, and diastolic is during refill of the heart. And you ought to know systolic, and you ought to know diastolic, and you ought to know how to auscultate using a stethoscope. That means you're listening. But what if we're in a high noise environment, like we are a lot, and you can't hear? Maybe it's in an extrication. You're trying to get a blood pressure, and there's rescue tools running. Maybe you're beside the road for whatever reason. There's a lot of road noise. Maybe you're in somebody's house, and there's lots of screaming and hollering, and the TV's turned up, and the dogs are barking, and you're trying to get a blood pressure. Maybe you're in the back of the ambulance, which is really kind of an EMT level thing, but I might as well say it to you now. Once you're in the back of the ambulance and the wheels on the bus are going round and round and you're moving toward the hospital, it's really hard to hear blood pressures. It's hard to hear lung sounds. And so auscultation is great as long as you can hear. But if you can't hear, we still need the blood pressure. And so there's a way to get a blood pressure when you can't hear, when you can't auscultate with a stethoscope. It's called palpation. It's the same sort of thing. You put the cuff on, you pump the cuff up to 200, you feel the guy's peripheral pulse, the radial pulse, if the cuff's on his arm. You feel his peripheral pulse. And you let the cuff off until you feel the pulse come back. So you pump the cuff up, you won't feel the pulse. If you do, pump it up more. Pump it up till you don't feel a pulse. Start letting it off slowly. The slower his heart rate, the slower you let it off. And at some point, you'll feel the pulse come back. Bam, there's your systolic number, your top number. And that's all you get. You don't get a diastolic when you're doing palpation of a blood pressure. So just go ahead and let the cuff off. So, blood pressure. Easy to talk about, needs some practice. Reps, reps, reps. And our coaches will coach you in lots of good reps on blood pressures. And you know what? You should start going to truck checks at your fire station. As soon as we'll let you go do that, you should go do that. You should start taking blood pressures all the time. You don't need to get your own cuff and scope. You don't need to do that. But you ought to go practice blood pressures all the time. And when you practice the blood pressure, practice getting a pulse rate too. Now, what we've seen with some new folks is that they're a little stumped by the math. And so they want to check a patient's pulse rate for 30 seconds or a full minute. And I'm telling you that's weird and it takes too long. And don't do that just because you're struggling with some math. I'll bet you that you can learn to multiply by 4. I'll bet you can take a 15-second pulse check and take that number of beats that you felt and multiply it by 4 and come up with the number of times his heart beats in a minute. His pulse rate is the number of heartbeats per minute. So, how you do it? Well, you feel the pulse, you watch your watch, you find a good place where you're ready to start, and you start counting. And you wait for 15 seconds and you stop counting. And you multiply it by 4 and write it down on the EMS notes form. Works pretty good, as long as you got a watch. So there's stopwatches in the EMS pack because a lot of folks don't wear a watch these days for some reason. So, hey, what about breathing rate? It's the same thing. The only deal is that if the guy knows you're watching him breathe, he may not be breathing normally. Now, people that are short of breath, breathing fast, they don't care who's watching. Fast is fast. But just a normal breathing rate, and you can do this on people in class or people at the fire station or people at home, and you watch somebody's breathing rate, they're going to be conscious of that if they know you're watching. So here's what we like to teach. Get the patient's radial pulse. Count it for 15 seconds and keep holding it and keep looking at your watch and count their breathing rate for another 15 seconds. So let's don't spend 30 seconds getting a heart rate and 30 seconds getting a breathing rate. Let's spend 30 seconds and get both those rates. That would make some sense. The other thing you can use to get vitals is pulse oximetry. Now we've said a couple times this is the O2 sat, the O2 saturation, a pulse ox reading, an SpO2. It's all the same thing, an O2 saturation. It's not a stat, it's O2 saturation. And so you should write their O2 saturation on the EMS notes form and note if they're on oxygen or not at the time, because the paramedics want to know, what's his O2 sat? You say it's 98%, and they say, is that on room air or is he on a non-rebreather mask? Because that matters to them, matters to their decision making. And so then one last quick thing here, and I promise to be quick. Beware of bad data. Bad data makes bad decisions. Pulse oximetry readings can give you bad information. If the circulation to the finger where the probe is poor, the finger is cold, or the blood pressure is low, the pulse ox reading's not going to be accurate. Now, the really last thing, a brief rant. It has become fashionable for lazy folks to put the pulse oximeter on and have it count the heart rate. Now, if that's a good, strong signal, and that pulse oximeter is on a finger that's perfusing well, has good circulation, and is not cold, it's going to give you an accurate heart rate probably. But that's not what it's on there for. The pulse oximeter has a heart rate indicator on it in order for you to verify the validity of that pulse ox reading, not for a quick, easy, cheap, lazy guy's way to check the heart rate. And it has become a shortcut that's really kind of silly. Because if that pulse oximeter doesn't have good perfusion to that finger, it's going to give you a wrong heart rate. So now you have a wrong pulse oximetry reading and a wrong heart rate. Half of your vitals are wrong because you were being lazy. So here's the appropriate way for you to do it. Get your hand on Mr. Smith's radial pulse. Keep it there. Put a pulse oximeter on a finger on that same hand. Look at the pulse oximeter. Watch the little bouncing indicator, the little bouncy bars on there. It's just like a cell phone signal or a Wi-Fi signal. If more bars are better, it will bounce or flash a light or in some way give you an indication every time it feels a pulse. If it flashes or bounces or indicates a pulse at the same time you feel a pulse, okay, let the pulse ox count your heart rate. But if it doesn't match, the flashing, bouncing indicator on the pulse ox doesn't match the pulse that you're feeling, then you got to count your own heart rate, and the pulse ox reading it gives you is going to be wrong. End of rant.